Am I using this thing right?
Yeah.
Hi everyone, it's an honor to be here. Like Vince said, I'm Elaine, and I'm a second year medical student at UBC. I'm a bit of a nervous wreck. I don't do a lot of speeches, as you might soon find out. But I'm here because I care about this crisis, not only as a doctor in training, but just as a community member. I'll be diving into some of the stats and evidence around safe supply, but first I just want to tell you a bit about myself. I've been in Vancouver for the past 2 years because of school, but I grew up in Victoria. And when I was in my last year of high school, I remember this chilling feeling of shock and horror that spread across the town when the news broke that a boy my age, another high school student, an athlete from one of the middle-class neighborhoods around town, died of a fentanyl overdose. I was a pretty sheltered kid, as are honestly most people that get into medical school. It was a complete shock to me and really hard to even comprehend how someone could be suddenly gone and leave behind friends, family, and a community in shambles grieving his loss. And it's even harder to comprehend that since then, thousands more across BC have died because of preventable toxic drug events. And just last year, the illicit supply killed 130 more people in the Greater Victoria area. I share this all to point out that this is not just a downtown east side problem or a Vancouver problem, even though that would be horrible and heartbreaking enough. But in fact, 85% of the toxic drug-related deaths are outside the downtown east side, and this is coroner's data. This is a BC problem that impacts everyone, people from all different walks of life and communities. I'm here today to use my voice as a medical student and advocate for pragmatic, humane solutions to ending this toxic drug crisis. I'm here to show my support for Eris, Jeremy, DULF, and Safe Supply. The science is clear. The harms of the unregulated toxic drug supply are clear. People with experience on the ground dealing with this is clear. And our chief coroner's recommendations are clear, that people are dying because of our increasingly volatile and toxic street drugs. And we can save lives if we urgently separate people from this deadly supply and instead provide them with a safer, regulated alternative, Safe Supply. To get Safe Supply to as many people as possible, as quickly as possible, we need to support non-medical models. And as medical students, we're taught about the importance of looking at the evidence, the research, and the data to inform what we do, our policies, and our practices. Prescribed Safe Supply in its current form is a pretty recent intervention in BC and Canada, but the emerging evidence is pointing to immense health and social benefits that we can't ignore. In 2020, the Ontario Drug Policy Research Network published a rapid review on the impact of prescribed Safe Supply programs. And from 15 peer-reviewed studies and 5 program evaluations, they showed that people who got a prescribed, regulated supply of opioids, who knew what they were putting into their bodies, experienced less overdoses. They had to go to the hospital less and the ER less. And since then, there's been more studies and advocates speaking out about similar positive outcomes of prescribed Safe Supply. Just last week, a prominent group of researchers from BC published a landmark study. This is the first large-scale population-level study on prescribed Safe Supply, specifically risk mitigation prescribing. This is something that started during the COVID pandemic, when physicians and NPs are now able to prescribe Safe Supply to people that they thought were at risk of overdose to help them quarantine and follow public health protocols. And what these researchers did was, for over a year, they followed around 5,000 people with opioid use disorder who got this risk mitigation prescribing and compared them to a group of similar people who were eligible but didn't get the same Safe Supply. And the results are remarkable. People with opioid use disorder who were prescribed at least 1 day of opioid Safe Supply were 61% less likely to die the week after compared to those without a prescription. Receiving 4 or more days of regulated prescription opioids reduced death rates by 90%. These are staggering reductions in mortality, and it's a huge discovery. Altogether, we have a growing evidence base telling us a consistent story that Safe Supply saves lives. Knowing the data, it becomes so overwhelmingly obvious that these are preventable deaths and how urgently we need to get people Safe Supply. which is why it's incredibly frustrating that only 2% of people eligible for prescribed safe supply are accessing it. The remaining 98% are left with no choice but to continue relying on the deadly street drugs. And a big reason why so few people can access safe supply currently is because of our medical model. I'm saying this as a medical student. I believe that physicians can really make a positive impact in helping people, families, and communities. I know they can also do immense harm at times, especially to people who use drugs. But I wouldn't be spending years of my life studying and training if I didn't think we could do some good. But the research and the people in these programs have pointed out that requiring physicians and NPs to be gatekeeping safe supply within a medical model presents with a lot of barriers to access. On top of that, it makes this model impossible to scale up. I'm sure anyone in this crowd can tell you how overburdened and crumbling our healthcare system already is. Physicians are just not the right people for this job of immediately curbing toxic drug deaths. That's not to say that physicians and other healthcare workers can't play a good role in this crisis, but ultimately, we need non-medical models to increase access to safe supply if we ever want a chance of getting it to enough people. But even until today, even after the coroner's third death review panel on this toxic drug crisis, the government refuses at all to consider non-medical safe supply. But DULF has shown us that it works. Jeremy and Eris took action into their own hands when they started DULF's Compassion Club. This is a novel, community-based safe supply intervention that gave out tested drugs to people at risk of overdose. And not only that, they published a comprehensive framework document that outlined all their logistics, their whole research protocol for how the club was going to undergo rigorous scientific evaluation, complete with an approved ethics application. And on September 25th last year, we got a preview into how well DULF was working. A year into their operation, preliminary results show that DULF Safe Supply caused 0 overdose deaths. Among the 43 members, the number of non-fatal overdoses was reduced by 1/3, and everyone also experienced overall significantly fewer hospitalizations, drug-related violence, and negative police interactions. For 7 years, we've been battling an unprecedented public health emergency where the status quo has become mass death, year after year, month after month, day after day, and at a time when we desperately, urgently needed to increase access to safe supply. DULF's Compassion Club has helped shine a light on a way forward. DULF continues the legacy of drug user activists who paved the way for innovative harm reduction, saving lives in defiance of unjust laws. DULF's work has not only helped save lives on the ground, but they've also produced evidence showing that community-led, drug user-led safe supply works. We don't need prescribers or a high barrier medical model. And on top of all that, DULF has given us the full blueprints for how we can expand their model to other communities across BC. DULF's contributions are invaluable. The charges against Jeremy and Eris need to be dropped immediately. Charging them would serve to unjustly punish their courageous, groundbreaking work when it was needed most. And ultimately, if they are charged, the consequences for the public will be deadly, as the status quo will continue, watching as our friends, family, loved ones, neighbors, and fellow British Columbians die needlessly, knowing their deaths could be prevented with safe supply. I'll wrap up my thoughts by saying that there's a lot we need to do to end this toxic drug crisis, create a functional continuum of substance use care for those who want it, end the war on drugs, end the war on the poor, the stigma, address the historical and ongoing harms of colonialism, and the prohibition laws that drive our increasingly toxic, unpredictable street supply that got us here in the first place. But the bottom line is that work must start by first ensuring a safe supply for people across BC. Thank you.